Okay. And so before we dive into today's agenda, I just wanted to share reminders on how to ask questions. So feel free to enter questions throughout the call by typing in the chat box or raising your hand if it's, you'd rather share that verbally or through the video. We might not have all the answers today, but as things are continuing to change, we'll be taking notes and can follow up with a Q&A for easy review. We've got a few presentations, so I know it's going to be a lot of information. So we have some updates from HHSA that Claudia, the CalFresh Program Manager, will be sharing. We also have Kate Edra with the UCSD Center for Community Health. She'll be sharing on the Mas Fresco More Fresh program. We also have a presentation on pandemic EBT, which I know that there's been lots of questions, so we really hope that this will be a comprehensive overview and also a chance to answer what questions you've been hearing from clients in the community. And that will be presented by Amanda Mascia. She is our Hunger Free Kids Program Manager. And then a quick update from 211. Last month, they had shared with us the volume of applications coming in and just wanted to give a chance for them to share out kind of what has changed over the past few weeks. And then we'll end with group discussion and kind of talk more about next month's call. Okay, so with that, I can ask Claudia to share some of those program updates.
Hi, good morning, Jake. This is Claudia. Good morning, everybody. I am new to CalFresh program, so I'll go ahead and introduce myself. My name is Claudia Gurrola, and I'm the CalFresh program manager here with HHSA. And I'll be giving you guys some information on what's been going on with CalFresh. For starters, you guys have the visual aid on the screen. Just a reminder to everybody, although there's a lot of messaging going on out there regarding county offices reopening for business, we wanted to let everybody know that as far as self-sufficiency programs, we never really shut down. Our services continued during the pandemic crisis. It was our #1 goal to ensure that the community was receiving the benefits that they needed. And the numbers that I'm about to share with you will reflect that. On the screen, you have some visual aids that track Family Resource Center visits. As you can see in a comparison, during the month of February of 2020, we had 78,492 customers come by our offices. Then in the month of March, when all of this started, that number reduced down to 43,236. In the month of April, because all of this unfolded so quickly, we did not track the number of people coming in to our outdoor services that we continued to offer. So although we had to close down our lobbies to make sure that we were in compliance with the social distancing ordinance, we continued offering services outdoors in our family resource centers. So there were stations set up where people could come by and either submit documents or applications for those that did not have the internet available or phone capability. Our staff were out there helping these customers. During the month of April, we did not capture that number, but in the month of May, we began a manual tracking of this, and it revealed to us that even though the month of May is not over yet, but from May 1st to May 22nd, we have seen 13,698 customers in person out at Family Resource Centers. Moving on from that, as far as applications go, just so that you can get an idea of how this has continued services with HHSA. In the month of February, we received a total of 12,078 applications. During the month of March, that increased to 16,613. And then in the month of April, when the whole pandemic crisis was full-blown now, and we were noticing a lot of people were losing their jobs and in need of these services, the applications spiked up to 30,079 applications received during the month of April alone. And those are monthly numbers. What this then results in is that we have a total. We also provided a comparison for the month of April. Individuals that are in receipt of CalFresh benefits in the month of April are 309,284. That is the individual number, meaning that if it's one application with 4 people in the household, we're counting each individual in that application. And you can see that the numbers really spiked in comparison to February and March. Do you want to pause there for questions, or would you like me to continue, Jake?
Sure,
I'll
yeah.
go ahead and continue.
We can open up. Anyone have any questions about those numbers before moving into some more of the updates?
So just, just to reiterate, just wanted to make sure that we were all aware that our offices never shut down. Our services always continued. Our staff have been working really, really hard to make sure that these benefits are being made available to our community members, and that families that are in need are being served with an efficient manner. So moving on. Do you want to bring up the other slide? There we go. So emergency allotments. Originally, we had been approved for 2 months. On April 2nd, we were notified by the state that emergency allotments have been approved and that they would be issued for the month of March and April. As of May 21st, we received confirmation that we would be extending these emergency allotments for an additional 2 months, which would now cover the months of May and June. And these benefits are being issued to customers on specific days. And I shared the calendar with you guys. As you can see, of the benefit month of March, those benefits, those emergency allotment benefits had been issued to customers on April 12th. If for some reason these customers had experienced some delay in approval, or there was a discrepancy with their application, which was approved after that date, there was a second batch process run on May 10th where they would then receive that emergency allotment. And then just to make sure that we covered all of these customers, there was a third batch run on June 14th to make sure that anybody who had been missed on the first and the second run, on the third run, they would be all receiving their emergency allotments. For the month of May, those benefits will be issued and available to customers on June 14th. And for the month of June, those benefits will be made available to customers on July 12th. So that's the background on emergency allotments. The emergency allotments are also, I do want to mention that there will be month-to-month continuation of these emergency allotment benefits, and they're expected, we should be submitting our request and approval on a monthly basis, but we are hoping that all of this continues until the state issued emergency or disaster declaration expires. Moving on to pandemic EBT. So the pandemic EBT, as we all know, these benefits are for our children who were attending school and were eligible to free or reduced lunch meals. These benefits are being issued at the state level. These benefits are not being issued at the county level. It's very important that we stress that to our customers. We don't want to mislead them to think that HHSA can do something about issuing these benefits. The application is online at the state website. We do have information regarding these benefits on our CalFresh website for our customers, and we have been training our staff, our access call agents, as well as our FRC staff on how to respond to questions coming in regarding pandemic EBT. So they will be able to provide some guidance for them. But we also are aware that for households that have been experiencing homelessness, those cards are being mailed to the PO box, the FRC PO box, which is at each office. So customers that normally use this address, they are made aware of their responsibility to come in and pick up their mail on a monthly basis. We just want to get the word out there. So if you guys are interacting with customers and they're saying, I haven't received my card, and you are aware that they're experiencing homelessness at the time, they might want to check at their Family Resource Center to make sure that their card was not delivered there, and so that they can pick it up timely. These cards will be held there until further notice, and if they're not picked up within an extended period of time, we will then consider mailing the card back to the vendor. So we have been granted extensions. As you guys know, when this whole pandemic situation started, we couldn't continue applications as we were with regards to conducting face-to-face interviews or collecting wet signatures from customers. So there were a lot of flexibilities that were implemented to make sure that we were accommodating the community and making sure that we were not causing a delay to benefits. And it has proven to be very successful, as we could see with the numbers that were shared earlier. Now, as we move forward, because initially the approval was only extended through the month of May, as moving forward, though, we have received some extension approvals. The state has put in for them, and they have extended some of these waivers. And some of those that are really important is the interview waiver. So customers will not be mandated to come in for an interview. We can waive those interview requirements so long we have all the information needed in order to determine eligibility. So the critical piece there is that we have to make sure that we're supporting our customers and making sure that they submit, that they're completing the application in its entirety, and that they're forwarding as much information as possible, so that then we don't have to interrupt them with contacting them or things like that. So the more information, the better. I know that there are some systems out there that accept applications with very limited information. We just want to encourage everybody to make sure that we're submitting as much as possible. That will make things work a lot quicker, and benefits will be available to our customers in a shorter time span. So having said that, the interview waiver has been extended, as well as the telephonic signature requirement. So we will be able to take verbal telephonic signatures from our customers. And that just flows right into the fact that in the month of June, we will be resuming recertifications and SAR 7 requirements. So having this interview waiver will extend out to recertifications as well. We're planning on sending, because our customers are accustomed to having to complete an interview during the recertification, so text messaging campaigns will be sent out. Also, we have created a flyer that will go out with the recertification packet, alerting the household that an interview is not required. But we do want to encourage, again, that they submit as much information as possible, so that we don't have to be repeatedly attempting to contact the household to get clarification. And last but not least, on April 28th, we went live with EBT online purchases. And when we went live, we had been made aware that Amazon and Walmart, who are the two people that are participating on these EBT online purchases, that they would be waiving the delivery fee for purchases that exceeded $35. Quickly after we went live on April 28th, we learned that that was not the case for Walmart purchases. Turns out that Walmart purchases of food that exceed $35 still must have, they still charge the $35 delivery fee. The state looked into that and they received confirmation from Walmart that that was the case. It was a misunderstanding during the agreement process. So we just want to make sure that it is clear. We have changed all our information on the CalFresh website to make sure that we are making our customers aware that if they are making purchases with Walmart, there will be a delivery fee and that it is not waived, even though it may exceed $35. They do have flexibilities on how to pay for these delivery fees. Unfortunately, they cannot use their CalFresh benefits on their EBT card, but if they do receive CalWorks, they can use that portion to pay for those delivery fees. But there are other methods of payments that Walmart will accept. And I think that covers my updates. Do we have any questions?
Yes, thank you so much for all those updates. I didn't see any questions come in yet, but I'll give a minute for that to kind of sink in, and for people on the call, whether you want to enter it into the chat or if it's easier to unmute yourself and want to ask verbally. Just thinking about, how do these updates and these changes affect the clients that you're serving? So I'll give you guys a few minutes.
I see one question talking about patients that are starting to call to schedule CalFresh research assistance, and they're asking if the county has sent out research for the month of May, or are all these June research that they are receiving. These are recertifications that are due in the month of June. So as you guys know, for the June recertifications, the paperwork is always mailed to the customer a month prior. So these are recertifications that are due in the month of June, because May recertifications were waived.
Great, thank you. Another question that I see is from Naomi. So it looks like Walmart is only offering delivery in New York. Is there any fees with grocery pickups that CalFresh recipients need to consider?
I was reading a section above that also, but okay, let me look at that one. Looks like Walmart is only offering delivery.
So just to give a little bit of background for the online EBT, so that was a pilot that was already up and running in New York, Washington, and I believe parts of Oregon. And it was something that our organization, with our advocacy work, did want to push forward, especially even before the pandemic. And so right now, Walmart and Amazon are the only two retailers approved. Grocery pickup, I do know that with your EBT card, you're able to place an order online for pickup, and then when you go, you're able to swipe that EBT card. So as far as I know, that there aren't fees associated with the grocery pickup. It's really that delivery fee that is becoming a barrier. But
that is correct. Yeah, that is my understanding too on that with regards to the pickup, that there would be no delivery fees, but yeah.
And then I see another question from Martha regarding how long it takes for clients to get the PEBT card after they apply. So Martha, if it's okay, I'll actually hold off on this. I think that Amanda might be answering that question when she shares on PEBT, but if not, I'll definitely log this to get an answer from CDSS.
And from the pandemic call that was held yesterday, the pandemic EBT call, I believe that they said it was 12 days, but if you want to confirm that.
Okay, great, thank you. We have someone that has a warrant for not turning in his AA meetings while courts are closed and was denied for CalFresh. Can anything be done? This is coming from Angel with Vista Community Clinic.
We would have to look at the details of that case. We're definitely practicing flexibility. So if it's something that we have documentation of, we should be able to work around that. I'm not sure who he has been discussing this case with, but if he wishes to elevate it to you, Jake, and you could share it with us, okay, we can definitely look into it.
Sounds good. Yeah, if there's any like specific case issues that you're dealing with, definitely feel free to loop us in and we can help to move those forward.
Absolutely.
And it looks like Amanda, our Hunger Free Kids manager, did confirm that it's within 12 days, but she'll be sharing a little bit more later on in the call. And then another question I see from Shelly, and that was regarding the delivery fees. So yes, unfortunately, Shelly, after it went live, Walmart, we found out, does not offer free delivery over $35 for groceries. That was for their other purchases, so I think there might have been some confusion there. So as of right now, Amazon does, but Walmart does not.
Correct.
Okay, so we'll also have time towards the end of today's call to answer more questions. That's all I'm seeing right now. So next, I'd like to invite Kate Edra. She's the program manager with UCSD's Center for Community Health to share about the Mas Fresco More Fresh program for CalFresh recipients. Hi, Kate.
Hi, Jackie. Thank you so much, everybody. And I did want to thank Jackie for inviting me to present the Mas Fresco More Fresh program with you today. So I'm actually going to share my slides. Okay. So my name is Kate Edra. I am with UCSD Center for Community Health, and today I will be presenting on the Mas Fresco More Fresh program. A brief agenda is I'm going to talk briefly about UCSD Center for Community Health, the history behind nutrition incentive programs, and then finally talk about Mas Fresco More Fresh program online enrollment, and then some key results that we've already seen from our program. So UCSD Center for Community Health, we operate under UCSD, but we actually operate as a nonprofit in City Heights. Our mission is to transform health and wellness in diverse communities by improving health and racial equity. And as you can see, we work in a lot of different public health sectors. We work in childhood obesity prevention, the refugee health unit, and then finally, food insecurity and nutrition incentives, which is what I'll be talking about today. So I am gonna briefly share this Mas Fresco More Fresh market match video that really does a great job of highlighting both of these nutrition incentive programs. So let me get that.
Fruits and vegetables, they're both key to maintaining good health. Unfortunately, not everyone can afford fresh, healthy food. In California, Market Match and Mas Fresco More Fresh nutrition incentive programs help families buy more fruits and vegetables for better choices, better flavor, and better health. When you spend your CalFresh dollars at participating farmers markets and grocery stores, the Market Match and Mas Fresco More Fresh programs provide a match, enabling you to earn $40 or more per month to spend on additional fruits and vegetables.
The program has helped me and my family eat more fruits and vegetables because they have made them more affordable to me. I'm able to purchase twice the amount of fruits and vegetables I was before the program.
Mas Fresco has definitely helped us a lot. We're eating way healthier. We're buying a lot of vegetables and fruit that we couldn't really afford.
All the different colors of fruits and vegetables have different vitamins that our body needs. It's just so exciting to feel these new vitamins charging through my body and helping me to be healthy. And it is so nice not to have to go to bed hungry anymore. The program has saved my life. It's been very good.
The Market Match program has helped give me the peace of mind that
I don't have to sacrifice healthy eating for my kids and our family. My kids, they like to try things that look a little bit different. Because of the Market Match program, we've been able to try fruits like dragon fruit or jujubes. Knowing that I have that little extra amount of money to spend means that we do come here and we spend a lot of money on fruits and vegetables.
When I first heard of the Market Match program, I was really excited. I love farmers markets. I love the culture of farmers markets. I like organic produce and local produce. I was a student with 2 children living in this community and struggling a bit. To me, really, it felt like somebody was respecting my efforts to get to another place in life.
These dollars also support local farmers, creating more jobs, and in turn, a stronger local economy for all of us.
We're on our own here and farming about a total of 65 acres. Before we started Market Match, we were at about 11 acres of our own. We probably wouldn't have started this farm here if it wasn't for the market.
As farmers, Market Match is great for our business.
Si no hubiera el programa de Market Match, no viniera tanta gente a este mercado. Me ayuda el negocio y también ayuda a la comunidad.
Market Match and Mas Fresco is a win-win for everyone.
Everyone deserves access to affordable, nutritious local foods. And with these programs, it's possible.
Healthy families, healthy communities, better choices, better flavor.
To enroll online in Mas Fresco More Fresh and learn more about the program, visit masfresco.org and click on Enroll. To learn more about Market Match and find participating farmers markets, visit marketmatch.org and click on Find a Market.
So that is our Mas Fresco More Fresh Market Match video, all filmed here in San Diego. I'm sure you all could recognize the City Heights Farmers Markets. So just a little bit of background about nutrition incentive programs. So in 2008, the 2008 Farm Bill authorized funding to determine if nutrition incentives provided to SNAP recipients increases the purchase and consumption of fruits and vegetables. So this pilot program was known as the Healthy Incentive Pilot, which was $20 million that was spent in Massachusetts, and obviously they were pleased with the results. So in 2014, the 2014 Farm Bill designated $100 million for the Food Insecurity Nutrition Incentive Program. And then in 2018, the Farm Bill renames the program in honor of USDA Undersecretary of Agriculture, Gus Schumacher, and designates $250 million in funding. So the Mas Fresco More Fresh program, which operates under UCSD Center for Community Health, we were actually a recipient of the 2014 Farm Bill as well as the 2018 Farm Bill. So we kind of have 2 programs that are running consecutive, and there's a little bit of overlap that's happening right now. So Gus Schumacher, the Nutrition Incentive Program. So the goals and objectives of nutrition incentive programs are obviously to increase fruit and vegetable purchase and consumption among program participants, and to also improve the nutrition and health status of participating households, while also reducing individual and household food insecurity and reduce healthcare use and associated costs. Approximately 2,600 retailers across 38 states and the District of Columbia provide nutrition incentive programs. So that includes over 1,600 farmers markets, 440 grocery stores, 342 direct marketing farmers, and 104 mobile markets, and 100 community-supported agriculture programs. And obviously the power of produce. So nutrition incentives empower families, they support farmers and retailers, and lift up local economies. In CalFresh, or in California alone, CalFresh clients have a buying power of almost $8 billion. So nutrition incentive programs drive more of this money toward local farmers and small businesses. And there are approximately 1,000 specialty crop farmers, and the programs support over 70,000 CalFresh recipients just in California. So the Mas Fresco More Fresh program, also known as the Southern California Nutrition Incentive Program. So we're an innovative nutrition incentive program utilizing point-of-sale technologies in a large-scale retail setting. We're one of the only Gus Schumacher grantees who work with a large-scale retail setting, and then we are also a research study. So we operate in Northgate Gonzalez Market, so they're our partner in this. They are the largest Hispanic grocery market chain in the United States. They operate 41 stores across Southern California, which are often located in food deserts. And under the supervision of Northgate Gonzalez's Teresa Blanco, they have a really great commitment to community health, which you can see with their Viva la Salud program, which brings in a lot of really great health clinics to Northgate Gonzalez to do free mammograms in October. They also do like flu clinics in the winter. So they're just a really great partner for us to do Más Fresco More Fresh. So the way that the Más Fresco More Fresh program works is we are currently operating in 6 Northgate Gonzalez markets in Southern California. So there are 2 in Orange County, 2 in LA, and 2 in San Diego. And we, our aim was to develop and implement and evaluate an innovative nutrition incentive program for CalFresh recipients. So like I had mentioned, we are a research study, so we were a randomized comparable trial. So we were randomizing participants into 3 different study groups. They would either get $10 a month, $20 a month, or $40 a month for at least 12 months. And we are a match program, which means that we match dollar for dollar CalFresh EBT dollars spent on fruits and vegetables. So for example, if one of our participants spends $5 in fruits and vegetables and pays for it with their CalFresh EBT card, then we match that $5 up to their whatever their study group allotment is. So we currently have 4 cohorts that we enrolled in 2017, 2018, 2019, and we are now enrolling in 2020. The first 3 study cohorts are part of the study, part of our study, but now that we are evaluating all of that data, if for 2020, anybody who signs up for the program automatically gets into the $40 a month program through the duration of the rest of the funding. And then, like I had mentioned, we were a recipient of the 2018 Farm Bill as well. So in September of 2020, we are hoping to expand to all 41 Northgate Gonzalez markets. And then instead of doing the 10-20-40, we're going to utilize a 2-to-1 and a 4-to-1 nutrition incentive multiplier for CalFresh recipients. So that would mean participants would be randomized to either get a 2-to-1 match or a 4-to-1 match. So for example, if they spend $10 with their CalFresh EBT card on fruits and vegetables, then we would match $20 or $40 based off of what study group they're participating in. And so with this program, with our 10-20-40 and with people who are enrolling in the program now, anybody who enrolls in the program now will automatically be rolled over into this new expansion. So you don't have to worry about not sharing out our information right now. Because anybody who enrolls in the $40 group will automatically be enrolled into the 4-to-1 match once we expand in September into all 41 Northgate Gonzalez markets. So this is how we're enrolling right now. So we used to enroll in store, and obviously because of COVID-19, we had to kind of fast track our online enrollment. We weren't anticipating starting online enrollment until we actually started with our new expansion with the 41 Northgate Gonzalez markets. But we have fast-tracked our online enrollment to only for only the 6 markets that are currently participating in the Más Fresco More Fresh program. So the 2 markets in San Diego are the ones one in Southeast San Diego, which is located on the corner of Highland and 43rd, and then we are also in the Northgate Gonzalez market in City Heights on University Avenue. So this is our website. It's really easy to use. Participants only have to type in masfresco.org into their web browser. This is what the website looks like. They could, the website could be viewed in English or Spanish, and then obviously all they would have to do is click on enroll, and they could enroll into our program. And then we also are sharing out a virtual postcard for all of our program partners to share out. And then we're also hoping to print postcards and then obviously distribute in other places. You know, we're looking at distributing at food pantries and, you know, at meal distribution sites, just to kind of get the word out to those who might not receive this resource, like via like an online resource. So I did want to share some key findings that we have been able to see so far. I'm going to try to be really brief. I think there's a lot of information here. And then just so you know, we are getting ready to share out our 2020 progress report, which will share a lot more information, including the information I'm sharing with you today. So at baseline, a proportion of our program participants who agree or strongly agree that cost is a barrier to eating fruits and vegetables. Across all three cohorts, there's I would say about 60% of the participants are agreeing or strongly agreeing with this statement. So as you can see, there is a change in the agreement to this statement across baseline 6 months and 12 months. So you can see at baseline, almost 57% of our participants agreed or strongly agreed that cost is a barrier to eating fruits and vegetables. And at 6 months, that number goes down to almost 53%. And then at 12 months, it's 48% or 47.6%. And then obviously the mean amount spent per month on fresh fruits and vegetables, you can see as the incentive dollar goes up, increases, then the mean amount spent per month on fresh fruits and vegetables also increases. And that's something that we've seen along all three cohorts. And then our participants are also reporting and increasing the amount of fruits and vegetables purchased at 6 and 12 months. So at 6 months and 12 months, we're asking, have you purchased more fruits and vegetables because of the Mas Fresco More Fresh program? And at 6 months, 95% of the participants are saying yes. And then at 12 months, that number jumps to 96%. And then this one I think is really interesting. So we do ask some food insecurity questions on our surveys. So I did want to start on the very right, where we're looking at the general population so the 2017 national estimate of people that are reporting very low or low food security. So you can see that's 11.8%. And then when you move to the left of people receiving SNAP, 48% of those report having very low or low food security. And then the three bar graphs to the left are our three cohorts. So they're reporting about 75% of our participants are reporting very low or low food security. So obviously, like, our program is reaching those that are most in need of having an additional financial incentive to purchasing fresh fruits and vegetables. And then this is our changes in food security level among cohorts 1, 2, and 3 at baseline 6 months and 12 months post-enrollment. So at baseline, 74% of our participants were reporting very low and low food security, and that number decreases to 70.7% at 6 months, and then almost 65% at 12 months. So that is a statistically significant decrease in food security levels among our cohorts, so this is something that we're really proud to report. So to kind of summarize some key results, so we have been able to achieve a significant increase in the purchase and consumption of fruits and vegetables among program participants. We have achieved a significant decrease in food insecurity levels among program participants. We developed a model benefit redemption system at retail, making it possible for thousands of SNAP recipients across Southern California to instantaneously earn and redeem financial incentives upon the purchase of fresh fruits and vegetables with their SNAP benefits. We developed an online enrollment platform enabling SNAP recipients to enroll online at any time. And then working in partnership with WIC, social services, health departments, and others to enhance the health and well-being of SNAP recipients. So I'm sorry that was very quick and very brief, but like I said, we are going to be sharing out our 2020 progress report fairly soon. And I did also want to highlight that in San Diego, we are highlighted on the 211 website. So a lot of our recent online enrollees do put 211 as the way that they did hear about us. So thank you so much, Claudia, for sharing out our resource. And now I'm not sure whether or not we wanted to open up to questions, Jackie, or do we want to wait till the end?
No, I think we can open it up if there's any questions related to this program. And I just want to say, thank you so much for sharing. This is an amazing program, and just hearing more of kind of like how it got started, and then just the research that you've shown of its impact. I think that what we hear way too often is that our community members want to purchase those healthy foods and fresh produce, but when dealing with their grocery budget, are forced to make those purchases on the cheaper, more inexpensive, less healthy foods.
Right.
One question I did see pop up is regarding pandemic EBT benefits. Is there any way for those benefits to be used, or is it strictly CalFresh?
I will have to find out. I'm not really sure. Once I do find out, I'll definitely share out that information with you so that you can share it with the rest of the people on this call. So the pandemic EBT obviously is something that I'm still kind of learning about and trying to figure out. So I think that we just need to try to reach out to our funders and find out if that's something that can be used towards the incentive.
Okay, awesome. Thanks so much.
Yeah.
All right, and yeah, I'll be sending out this PowerPoint and all of Kate's contact information for anyone that wants to ask any more questions or participate and be able to refer clients to this awesome program.
Thank you, everybody.
Thank you. All right, so I'm gonna go ahead and share my screen and get us, so next we're gonna invite 211. I know I had mentioned that last month Carla had shared about the influx of calls for assistance through their call center. And so we have Sherry is 211's Enrollment Center Program Manager to share a quick update on how things have changed over the past few weeks.
Hi, good morning, everyone. Very interesting presentations. It's great, Jackie. You do such a great job with facilitating. I'm envious. So 211, what's happening? Well, same thing is happening with the county overall. We're still at about double the volume here toward the end of May. We've already taken well over 2,000 applications for the month of May. We were able to bring on, in partnership with Home Start, Guadalupe and Angelica have been helping us since April 21st, I believe, is when we started. And they have just been great partners. It's like they've worked with us forever. I just think of them as an extension. They have year-to-date submitted 153 applications, and Guadalupe averages about 7 a day. And we send a list of leads that we have that are waiting for more of an immediate callback situation, and they're both very good at getting to those clients within a day, 2 days at the most, so they're not waiting more than a day and a half for an appointment. The good news for 211 is that our calendars are back down to a more manageable level, so for scheduling online or calling into 211, the wait time is now back down to a day, 2 days at the most. So I don't know. I know Guadalupe's on the call as well. I don't know if she wants to jump in and has anything else to share, or if there are any questions.
Does anyone have any questions regarding 211's Enrollment Center? I know that they have a few different referral options. I think that this would be a great time to get any of those questions answered since we have Sherry on the line.
Sherry and her dog, I'm sure you can hear in the background. Every time I come off of mute, that's when she barks.
Hi, good morning, everyone. This is Carla with 211. I just wanted to add, thank you, Sherry, for sharing with the group the partnership we've had with Home Start and Hunger Coalition. I just want to add that if any organizations are out there, just double check with our resource page, our resource team, and you could do that online to just make sure that CalFresh is listed as a service. I think we identified that a couple of partners who are actually doing CalFresh application assistance in the community, although they have a referral, or although they have their services listed in our database, CalFresh may not be one of them as a service is offered. So you guys could just go to 211sandiego.org, click on partners, and you'll see the information there. You'll be able to see your own service listing to see, oh yes, everything's updated, everything's good, or oh no, we added these new programs and I could plug them in right then and there, and you could do that yourself. So just wanted to send that or share that with the group that, just please double check that all of your services are listed in our database, especially now since we have a higher call volume and a lot of people are calling for information, and folks could even access your site, your information referrals on their own on the website. So, if you have any questions, you could reach out to myself, but you guys could do that on yourself. There's a self-service portal at our website.
Awesome. Thank you, Carla.
Thank you.
I'll include that reminder and the link to that partner page. I think that there are several organizations, even before working from home, that have transitioned to CalFresh Assistance, just seeing the need and the impact of the program. So yeah, it would be great to have that information up to date, since so many individuals are trying to access and navigate the 211 website to find services in their area. Awesome. Well, thank you, Sherry and Carla, for sharing today. All right, so next I'd like to invite Amanda Mascia to just briefly introduce herself. I think this is the first time that you guys are meeting her, and then to share the pandemic EBT program.
Thank you. Hi, my name is Amanda Mascia, and I am the Hunger Free Kids Manager at San Diego Hunger Coalition. I previously was a nutrition, or I cooked for children, so I was a culinary director at an after-school program for 200 at-risk youth in Oceanside. So I used to make burritos. So I love connecting kids with food. So I'm going to take you through pandemic EBT. I'm going to share my screen. And pandemic EBT, we're hearing a lot about it, and that's because it is a tremendous opportunity. So, all right, here we go. So pandemic EBT stands for Pandemic Electronic Benefits Transfer, and it's exciting that over 250 San Diego students are eligible for $365 each in PEBT benefits. And that amounts to $91,250,000 in grocery money available to San Diego families. So the way that we put it is very simple. PEBT, get up to $365 for groceries per child while schools are closed. While schools are closed due to COVID-19, families with students who were receiving free reduced price meals at school can get up to $365 per child for groceries this summer. This is a federal nutrition benefit. It is part of the Families First Coronavirus Response Act, and it's in addition to continued grab-and-go meal services at many school sites throughout San Diego County. So we want to be clear that students can continue to go and receive those free meals that are being offered at school districts and get the PEBT benefit. There are currently 2 ways that students can access these benefits: direct certification and enrolling online. I'm going to take you through both in a little more detail. So direct certification is for students who are enrolled in CalFresh, Medi-Cal, or foster care benefits. They should have automatically received a PEBT card in the mail already. And so if you look on the left there, that's an example of the letter that they would have gotten in the mail with their PEBT card. We want to point out that this letter doesn't really have a whole lot of air of authority to it or authenticity. So a lot of people, when they receive the letter, they don't think this is a real benefit. So any help you can get saying, hey, this is a real card, please save it. It could be worth up to $365. All hands on deck getting that message out, because some people didn't even know to expect it. So please let them know this is a real card. The other way students can enroll is enrolling online, and the website is live now. It went live this weekend, and millions of families and students are enrolling online. They've had a lot of fantastic traffic. So it's ca.p-ebt.org. So students who were receiving free or reduced price school meals but have not received their card yet, they must apply online before June 30th to get their card in the mail. So it's a pretty quick window turnaround by June 30th to get their card in the mail. and it takes about 12 days to get their card. We're going to take you through the application process. It's very simple. So the basic information to apply is student's name, birth date, name of the parent or guardian, and the address that the student is registered at the school with. So the first question is your student able to receive free or reduced price meals during the school year? We're going to pretend that we're choosing yes. And then they're going to prompt you. Have you already received your PEBT card? If your answer is yes, then it's going to tell you you don't need to apply. We're going to go as if we have not received our card. So then it asks you to list all the students in the house. So one at a time at all students in elementary, middle, and high school. This can include pre-K or TK students who get free breakfast or lunch at school. I know there was a question about college-age students. This is for students in elementary, middle, and high school. So you add your students, so first name, last name, date of birth, and then you choose what type of school that the student attends, public or private school. And then you can list all the students in your house. This is important because when the card arrives in the mail, the card should have the oldest student's name on it when it arrives. And if a parent or guardian applies for more than one child, all benefits should be on just one card. And then the adult in the household or the adults can use that card to shop for the whole family. They'll then ask on the website for the best address, so the address that the school has on file. And then they'll also confirm that this is the best place for you to get your mail for the next 2 weeks. And the very last thing is add a parent or guardian signature. We do have confirmation that people can help families fill this form out. It's simple, but not all families have access to internet. So if you'd like to help a family fill this out, it's really easy. The PEBT cards should arrive in the mail between 5 and 10 days, though we did hear at least give it 12 days before calling or checking on the status of the card. And the PEBT card is very easy to use, just like a debit card. It can be used at grocery stores, farmers markets, online grocery orders, Walmart, Amazon, same thing. Delivery fees may apply. We want to make sure that we're saying that delivery fee caution. So frequently asked questions. There's lots of questions with PEBT. When is the deadline to apply? It is June 30th. What if I applied online and haven't received my card? How long do what if I applied online and haven't received my card? So call the customer service center. We want to say that the customer service center line is a little challenging, and the customer service center line is aware that their line is a little challenging. So we're going to be providing a little bit of feedback about how to make it easier. They're open to some suggestions. So we're hoping it gets a little more streamlined for PEBT. How long to spend the PEBT benefits? PEBT benefits you can use up for 1 year beginning on the date of the activation of the card. And what can you buy? You can buy food in all those grocery stores, farmers markets, online, but it cannot be used to purchase non-food items. Question we get a lot for people who haven't accessed benefits before: how do I use it? You use it just like a debit card. This is really important. So does PEBT count against me under public charge? No, it does not. Using PEBT benefits does not impact you or your child's immigration status. The public charge rule does not apply to PEBT benefits. These benefits are meant to replace school meals and are for all families that receive free and reduced price school meals. And this information is taken from our friends at FRAC, the Food Research Action Center, and we've seen that on every presentation. It does not count as a public charge. That's very important to get out. How do you check your balance? What if your card is lost or stolen? Again, the advice is to call the helpline. We're going to be working on streamlining that hopefully a little bit. And we need everybody to help spread the word. San Diego Hunger Coalition, we've been sending out emails and asking absolutely everyone, share the information about PEBT. Because there are 250,000 eligible children across San Diego County, and there's really just a month to get the word out, this is all hands on deck. And we're here to help. We've developed a lot of content. So we have flyers translated into 10 languages. We have that all posted on their website. I'll put our website URL in the chat. We have an FAQ sheet on our website. We have social media graphics and memes you can share. And then we have text scripts. So if somebody wants to do a robocall or actually text out or send an email, we can help you with all that content. And we're going to be hosting webinars or we can present. And we also have been reaching out to media. This is a sample school district plan, but really any of these tools can be used in any organization where you can communicate. So we're asking to forward our email and forward information about PEBT to any and all staff or people who have access to students and families. Print the flyer, pass it out, link to PEBT on your website, post it on social media, hand out or print the flyers in any kind of in-person contact. If you're able to put anything on a marquee or in a window, robocalls, text, emails, systems, and if you're able to help people with in-person signups, that's fantastic. And if you have any strong volunteers who would like to do some phone banking to any and do any outreach, they can also call through and just encourage everyone to apply. So our goal is simple. We want to connect as many students as possible to food through PEBT benefits and school meals. But the future is not so simple. You know, with COVID-19, a lot of stuff's up in the air, but we know that PEBT is a way to support families now, and it may continue as a benefit if schools are closed in the future. So PEBT is included in the HEROES Act that has been passed through Congress, and it might continue on. So if schools close again and somebody has a card, maybe if we can get it passed, that benefit might get uploaded, and they might get more money uploaded in their card. So it's important we get people enrolled. Please keep in touch. Let us know if you're doing outreach and how we can help. This is my email. I'll also put that in the chat. And we also wanted to share a quote from San Diego Supervisor Nathan Fletcher. He says, children, because of this pandemic, are missing out on many enriching benefits that schools provide. But this program ensures students and their families have access to the money for nutritious meals. Let's prevent kids from going hungry and join the San Diego Hunger Coalition in educating families about pandemic EBT benefits. So that is my presentation, and we thank you for any advocacy and help in sharing PEBT.
Awesome, great job. Thanks for sharing. One question I'm wondering if you could elaborate on is, given that this is a federal program, what the impact in San Diego County would be, since there's about 250,000 students eligible, what that would mean for the San Diego community.
Oh, we did the math. It's $91,250,000 brought into San Diego County to San Diego families. So that's wonderful. We know you have to spend money on food no matter what, so it's great. And that all could be spent locally. We assumed it would be too.
Awesome, thank you. Let's see, so questions that came in. So one, and we've heard this from a few partners, that the customer service line is telling clients to call their local designated county. So I know that we want to make sure that people understand that this program is operated at the state level. So for individuals that call Access, I believe Access, the only information they can provide is the same that we are here, and that's either to call the EBT hotline if you should have received that card, to get an update on the status, or to be applying through that website. So as Amanda mentioned, the EBT hotline is been used for CalFresh, and so adding this new program right now, we're hoping to streamline some of that language so people are able to get through. It is unfortunately confusing. I'm not sure if anyone else wants to share any experiences that they've had, or maybe what you've heard from clients related to the PEBT program. One question is, as far as would all kids in a family, would everyone be on one card, or would there be multiple cards for students? And it sounds like it depends on a data match. So just based on how CDSS is pulling that. I don't know, Amanda, do you have any more info on what that looks like, of if they're receiving one or multiple?
We've heard that if they're able to match it, it should all be on one card, but we've also heard of families receiving multiple cards.
Okay. Well, as you guys are spreading the word and clients might be coming back with questions, please keep the Hunger Coalition in the loop. We really want to make sure that we're providing examples of some of the barriers people are experiencing with the EBT hotline, just to make sure that it's going to be working for everyone. So definitely thank you, Joe. And there's a few other partners that shared with me some of the difficulties in when calling that hotline. So one question that just came in is, some of the clients said that they only received $365 for 3 kids. Do they have to call that in, or is it only $365 for all of those kids?
It's $365 per eligible child if they were enrolled already, so for free and reduced price meals. So I would say they should call, and then depending on what the helpline says, I would apply for those additional children.
Okay, great. All right, well, one thing we wanted to do just to kind of drive some of those bullet points home is just to launch a poll, just to get an idea of how this information is settling. So I'm going to go ahead and launch that. There's just 3 questions. So I'll give you guys a minute or 2 to fill those out, and that'll kind of give us a better idea of how we're sharing this information out, and any other questions that you guys might have. Okay, I'll give a few more seconds before ending that, and then can share out those results. And again, all of these are anonymous.
Using the audio, might use anything else.
Okay, so I'll go ahead and end that and share those results. Are you guys able to see them on the screen? Okay, so deadline to apply, great, 100%. So yes, June 30th, we really want to drive that home and make sure that no one is missing out on those benefits for eligible students. And do you know a student or a family that could benefit from this program? Love it. So 86% do have those connections with these families. And then do you pledge to help spread the word to ensure that all eligible households know to apply? We got 100% there. So I want to thank everyone on this call for really helping to connect people. One thing that we found out, and this might have been shown when Amanda was walking through the PEBT application, is since there are certain families that maybe weren't receiving CalFresh but are eligible for PEBT, this might be their first time accessing a public benefit such as this. And so at the end of the PEBT application, they do have a button to apply for CalFresh. So I think that this is just a great way to kind of use both programs to make sure that anyone that's eligible is able to apply and receive these benefits. All right. Well, let's see, I'll go back to the chat. I think a few other questions might have popped up. So there is a question, so PEBT, does it work for online shopping? So yes, it's gonna work the same for grocery stores and farmers markets, as well as online shopping. Someone has a client with an undocumented child at school. Can they receive the PEBT for that child? So that is yes. So again, as Amanda had mentioned, there is no public charge, and the card is actually going to be in the child's name. So anyone that is receiving free or reduced price meals is eligible for these and will receive that card, whether automatically or through the application process. All right, well, thank you again, Amanda, for sharing. That was definitely a presentation I think multiple people have been looking forward to, as this is such a new program that just quickly came out to address the school closures. There's a question about the benefits expiring and if there is a certain day that they need to be used by. So yes, that's going to be 1 year from activating that card that they'll be able to use those benefits. We have a question of, could we review who are receiving the cards in the mail without registering on the website? Let's see. Might have to take that back. I'm not sure. I feel as though what CDSS is doing, and I don't know, Amanda, if you have information on kind of what that process looks like as far as like the data matching.
Yeah, I'm not quite sure I understand the question.
Let's see. Kinsey, do you have a microphone? Would you be able to maybe explain a little more?
Sure. Can everyone hear me? Okay, sorry. So my question basically is asking, I know you briefly mentioned that certain people may get this in the mail without really doing anything. My question is who, who's going to just be receiving this without any need to register online?
Sure. So those that should receive the card, should have received the card already, are students who were eligible for free and reduced price meals and are enrolled in CalFresh, Medi-Cal, or foster care benefits. And so those cards should already have arrived. There's maybe 40,000 that the state said that they have yet to send out, but otherwise they should enroll. Does that answer your question?
Yeah, thank you so much.
Okay. Thanks for asking.
Yeah, and these questions are really helpful. Again, we have the FAQ, but we've decided really to keep it a living document because as things are, possibly changing and new information is released, since it's such a brand new program. So we'll make sure that we have that link sent out. So as updates come in, you can access the website versus, having multiple emails being sent out. So we have a question about, should everyone who's eligible for PEBT have received their card already? Because we don't want to create multiple accounts if possible.
So only those that are directly certified through CalFresh, Medi-Cal, or foster care should have received their card already. Everybody else needs to apply.
And the application went live, let's see, it was last Friday, so that was the 22nd. So since it's about a 10-12 day, as of right now, someone who applied on Friday when it went live, I don't believe they yet would have received their card. But we're definitely keeping a pulse in the community to see kind of like from those that applied on Friday when they're receiving it. and then also working with the EBT hotline. If a child receives CalWorks, should they also automatically get it? So CalWorks is included. I think just because, and I'm not too familiar with the CalWorks program, but I believe those on CalWorks are also automatically on CalFresh. I don't know if there's anyone that's more familiar with that program. So I think that we just use the CalFresh and Medi-Cal to kind of simplify that message, since that they would be receiving CalFresh. So CalWorks is one of the programs that should automatically trigger a card being sent to that household. All right, well, if there aren't any other questions, at least not right now, as always, you can reach out to me via email or phone. Again, we really love hearing from you guys that are the boots on the ground, directly serving our community, to find out, how we can help support you, and just improve the process to make sure that it's streamlined and easy for everyone. So I'd love to go ahead and just open this up as far as if anyone has any questions related to any of the information shared today, whether from the HHSA program updates, the Mass Fresco program. Does anyone want to share if they did any special events or creative outreach this year for CalFresh Awareness Month? So I know for us, we created a social media toolkit that's really, I think, CalFresh Awareness Month tends to be a lot of those outreach events, and this year that wasn't possible. So yes, recertification in SAR 7 will continue in June. Noemi just wanted to confirm. So yes, that is what Claudia had shared. So they'll start receiving those notifications.
Come on, person.
Well, I'd love to hear if there's any topics or presentations that you would find helpful to see on next month's call. I know we've gotten a lot of questions about unemployment, so I was going to look into seeing what information or contacts we might be able to bring to this group. But I'd love to hear from you if there's any specific populations within CalFresh or outside in the community that could partner to provide that information to you.
I'm going to call them and see if I can get those.
All right, well, if you guys don't have any questions or comments, I'll keep this open, similar to when we do our in-person meetings. There's always a chance afterwards for you guys to connect. So you can easily use the chat function to send a message to specific people if there's someone that you're looking to follow up with. So I'll keep this open, but thank you everyone for joining us, and I just want to thank you for all your work. It's been incredible to see the increased demand to be able to meet that need and make sure that people are, getting those benefits in time to be able to meet their dietary needs. So thank you.
Thank you, Jackie. This is Kate. I'm trying to find out more information about the pandemic EBT and Mas Fresco. So I'm hoping to share out that information with you so that you can share it out with the rest of the people on the call.
Okay, Awesome. Yeah, thanks again. That was great information, and it would be incredible if that is possible, but I do understand if it's like research related that how that might work with bringing in a whole nother program.
Well, it's more about how we're allowed to match the incentive. So I'm just curious if it's, so I do know that it's funded through CDSS, through CDE, through USDA funding, but Mascia Fresco and most nutrition incentive programs, we mostly match SNAP dollars. So I'm curious whether or not this is considered SNAP dollars, or if this is like a whole other funding. And I think that that's kind of how we'll figure out if Mascia Fresco can match these dollars, or if people could sign up for our program with the pandemic EBT.
Okay, awesome.
Yeah.